The enigma of Cotard delusion. Origins and understanding. Cotard delusion, also known as Cotard syndrome or walking corpse syndrome, is a rare psychiatric condition in which individuals believe they are dead, do not exist, or who have lost their organs or body parts. It is one of the most bizarre and fascinating mental disorders, highlighting the complex relationship between the brain, body, and sense of self. Origins of Cotard delusion. Cotard delusion was first described in 1880 by French neurologist Dr. Jules Cotard. Cotard presented a patient he referred to as Mademoiselle X, who claimed she had no brain, nerves, stomach, or internal organs, and was convinced she was already dead. She refused to eat because she believed she did not need sustenance as a corpse. Cotard initially termed his condition le délire de négation, the delusion of negation. Over time, Cotard's observations led to the recognition of this syndrome as a psychiatric disorder characterized by extreme nihilistic delusions. It has since been linked to a variety of conditions, including schizophrenia, severe depression, and brain injury. Symptoms and characteristics. Patients with Cotard delusion typically exhibit severe depression and detachment from reality. Common symptoms include nihilistic delusions, the belief that parts of their body or even their entire existence are missing or dead. Denial of life. Patients often deny being alive or believe they are in an afterlife, despite evidence to the contrary. Somatic symptoms. Individuals may experience physical sensations that reinforce their delusion, such as feeling their bodies decaying or their organs shutting down. The delusions can vary in severity. Some patients may believe they are spiritually dead, while others deny the existence of entire worlds or think they are immortal but cursed to eternal suffering. Causes and neurological basis. Though rare, Cotard delusion has been linked to various neurological and psychiatric conditions. Brain damage. Research suggests that brain regions associated with self-perception and emotional regulation, such as the parietal lobe and the frontal lobe, may be implicated in the disorder. Mental illness. Cotard delusion is often found in individuals suffering from severe depression, particularly psychotic depression, where distorted thoughts can lead to feelings of worthlessness or non-existence. Neurological diseases. Conditions like Parkinson's disease, multiple sclerosis, epilepsy, and stroke have been associated with the onset of Cotard delusion, possibly due to disruptions in the brain's cognitive function and emotional circuitry. Treatment and prognosis. Cotard delusion is challenging to treat due to the deep-rooted nature of the patient's beliefs. Treatment typically involves a combination of antidepressants, antipsychotics, and electroconvulsive therapy, ECT, which has shown some success in alleviating the symptoms in severe cases. Therapy focuses on addressing the underlying psychiatric condition, whether depression, schizophrenia, or neurological impairment. Though rare, early and intensive treatment can result in partial or complete recovery. However, without intervention, the condition can lead to extreme neglect of self-care, malnutrition, and suicidal tendencies, as patients believe they no longer need food or medical care. Conclusion. Cotard delusion remains a medical enigma, the exact cause and mechanisms still not fully understood. It is a striking example of how the human brain, when impaired, can distort a person's fundamental sense of reality. Despite the delusion's rarity, the disorder sheds light on the complexities of brain function and highlights the delicate balance between perception, self-awareness, and mental health. Conclusion. Cotard delusion remains a medical